Hello and welcome to the Made in Africa podcast. I'm your host, Kemeshi Samuel. And in the studio here with us, we have Irene Nwaukwa. She's founder and CEO of Infinity Health. Welcome, Irene.
Thank you very much. Thank you.
Amazing, amazing. If you've been a long-time listener of the show, you recognize Irene because she has been on the show in season 2. She was on season 2 of the podcast. And it's so nice for her to join us again on season 3. Thank you very much.
Thank you. It's a pleasure to be back.
Amazing. So, right into it. Uh, what was it like growing up? And would you say your childhood and the environment you grew up in sort of like influenced the industry you're working in and you as an entrepreneur?
Of course, in two different ways. So my childhood influenced the industry I worked in and worked
Okay.
in because right from when I started as a kid, I've always known I was going to be in healthcare. I mean, from like forever, I always
Wow.
wanted to be a cardiothoracic surgeon. And
Please. What do those guys do? What do those guys actually do? Because I've not heard that before.
and people who, do your heart transplants and cool.
Oh,
Yeah.
nice.
But even then, I didn't know what it was.
Yeah.
But I just knew that we didn't have. I didn't know female surgeons. And I was really interested in being that woman that went into male-dominated spaces and won.
Okay.
Right from like when I was a kid, this whole thing where, as a kid, you're like, why can't the boys do this and I cannot do it? I must do it, So it was literally, those things. And, for the longest time, I always tell people whenever I'm, doing something, not great, I tell them, don't follow me and do bad things. Me and my father's WHO DGO.
Wait, did you do you have a lot of brothers?
Yes, I actually do.
Okay, I feel like
I have a lot of brothers and cousins,
Yeah.
and I say that because right from when I was a kid, my dad used to say, why can't you be, we used to look at all them Ngozi Okonjo, Wala, Ezekwesili, and those were really the people that we looked at, especially as I grew into as a teenager.
Yeah.
And into womanhood. Those were the women I looked at and I said, yeah, I want to be
Like that,
this.
yeah.
Yeah. I was already in senior secondary by the turn of Nigeria's democracy, and so we saw women at the forefront, and it was very inspiring, and it was one of the reasons why I was very interested in being and winning in male dominated spaces. But after a while it became more than that. So in my family we have a principle:
Okay.
if you say you want to do something, you're going to do it to the highest level.
Oh wow.
So you see,
Excellent.
you're going to my dad always says charity begins at home,
Yeah.
right? So when I said I wanted to be a doctor, well, that means I became in charge of cleaning up all the cuts and scripts in the family.
Yeah.
And I didn't go to med school finally, because Nigerian education was very traumatic for me. It's very hard for me to go back to school.
Right. Right.
I became, and then I didn't mean to be an entrepreneur up until January 2023. I was scared out of my mind about being an entrepreneur.
Yeah.
One, because I historically and from my family, we don't really have too many entrepreneurs. What we have are professors, educators like my mom, engineers like my dad, people who've worked in private sector and public sector, at very high, levels.
Yeah.
And so, those were the models. I knew for sure I didn't want to work at them in public service or in civil service because I watched my mother go through civil service. It was not funny. So I knew, civil service was not for me. But, at everything that I do, I always ask myself, what is my path to doing this at the highest level? So when I finished, my first degree in biochemistry, the plan was really for me to go to med school, but I was really I wanted to work.
Okay.
And so I was working in an oil and gas company, and an oil servicing company, and I was working as a lab analyst this time around, not in the hospital, but in the field lab. And when I was thinking about what next for me, I'd done an internship in a hospital at that before then, and so I went back to the GMD at the time of that establishment.
Okay.
And I was asking him, what is my path? And he said, if you want to work in the lab, you have to go to Uniport. We grew up in Port Harcourt. You have to go to Uniport. You have to do several, courses and cool. And then but I didn't do it. I chose not to do it because, I don't know anybody who went from lab to, CMD of the hospital. And, and so that's why I thought, okay, this is not my path. I can't do this at the highest level, at least not in this country. I didn't have any visibility. Yeah. And then I said, okay, what's my path in the oil and gas industry, right?
Yeah.
I thought, do I want to specialize in HSC? Do I want to, specialize in, chemical engineering, and stay in the lab? Chemical engineering was too far off from what I was doing. Right. I don't even like chemistry.
I don't have a fan of chemistry. Full disclosure.
My sister is really great at it. She works as that right now. She's a mud engineer and everything. But
I have serious respect for those kind of people.
But I have my late uncle. He was a doctor in organic chemistry. Published researcher, everything. Yeah.
Wow.
So all this, the chemists in my family, but me, I don't know. I didn't take that gene. Physics and chemistry were horrible. So I knew that was too far from where I was going. And then, one day someone said, "Oh, medical rep, medical sales." And I tested it for a month and decided to go directly into it for two reasons. One, it was very close to what I wanted to do. Yeah. And two, I could see people rise to the head of pharmaceutical companies, from ground. Yeah. And I tell people.
But what was going through your head in terms of like earning capacity? Right.
I left
exactly, and the disparity from where you were and where you were going.
I left a 120K a month oil and gas job for a 50K a month medical rep job.
Oh my goodness. That must have been scary.
Yes, it was. Well, they promised me a car that did not deliver. But it wasn't too scary. Well, it's another thing too that I like to tell young people. When you're young, take risks with your life, right? So I did things that, today they are unethical. Please, nobody should do it in my company. I took my 1 month leave. Yeah. I went and started in another state. I had job. Started medical rep in another state. Yeah. Because I want to try it. I want to see, do I like this thing,
Before giving up.
Yeah. And I did it for 1 month. I didn't get paid, but I made money, one. And two, I saw, people who were where I wanted to be. Yeah. Now, I tell people all the time, a sales career is a fantastic thing. It's a blessing in disguise for most people because it kind of forces you to mature very quickly and develop skills very quickly, communication, engagement, people management, self-management, you get to build all of these things very, very, very quickly. Yeah. And you get to also, it puts you out there, it puts you on the map.
Right.
So because you've done sales, you get to meet so many people that you ordinarily wouldn't have access to. You also learn how to build access. So, when people say things like, when I say, I want to meet this person and they don't want to introduce me, I'm like, where are you?
Calm down.
Yeah. Don't worry yourself. Don't beat yourself about it. If I want to meet someone, if I want to get to meet someone, I can do that. Wow. I've built the skill necessary for me to get to anywhere I want to get to, really. So it's those things. You learn to think on your feet. You learn to. I don't know if it's sales. If in general everybody in sales learns to be remarkable from the very first time that they opened their mouth. But,
Over time.
I tell you one thing about me. Every time I open my mouth, I go to a place and I contribute. I'm completely unforgettable.
Wow.
So,
Wow. That's impressive.
and it's because, it's because I speak up. I do really do have a penchant for speaking up, and speaking very passionately. Sales also does that to you,
Right.
too,
It helps you
because
hone that aspect of
like, how do you sell
communication
something without
if you're not speaking
enthusiasm?
up. Exactly.
How do you sell something you're not passionate about and you don't believe in it to the depth of your
You
core?
don't know, like really know about it. Yeah.
So it was those things. But I became an entrepreneur because out of pain, really. I didn't want to be an entrepreneur. 1 month before I became an entrepreneur, I always say this. 1 month before I became an entrepreneur, I kept saying, I don't want to be an entrepreneur. I want salary. But
It's not because it's not easy building anything.
yes, and it's
not.
Till date, it's the hardest and the scariest thing I've ever done in my life.
Can imagine.
But I did it out of pain. The pain of seeing the solutions that we need die. For instance, I have so many personal, very painful experiences in recent times. Actually, a company that would have reduced the time to diagnosis for someone very close to me.
Okay.
And maybe have made a difference. I don't know, but they died a couple of years ago, and now we're sitting and waiting for test results. It's almost 8 weeks. Could have gotten it in 3 if that company was still here.
Wow.
I once sat in Kenya with pacemakers available to me, and a loved one needed a pacemaker in Nigeria in the thick of COVID. And we're looking for it over the I couldn't find. So it's those things. And it's not because when people talk about medical tourism a lot, a lot of times it's not because we don't even have the professionals. We do actually.
Okay.
Quite a number of brilliant Nigerians, locally doing really, really interesting things. But sometimes it's also infrastructure. Right. So you have the best cardiologists, but now the double chamber pacemaker that you need is not here. So what do
What do you do?
So you're better off abroad.
Yeah. That's why they're leaving.
With somebody who's not even the best of the better than that. Who's not even as good as that person.
Right.
So these are some of the things. And we set out when we started out in 2023. We started out first with a consulting company. So when we started out in 2023, we started out, as a consulting company. And the reason was, I said I wasn't going to, do the startup until we figured out, where we want to play that will have the most impact. So we started a consulting company, and our biggest, we just wanted to help healthcare businesses grow, because you see, if we're going to have good healthcare, we cannot have one center.
True.
We need to have many centers that are able to
standardize.
We need to have many options. I keep telling people, especially in healthcare, there's no competition on anything. We're not in that space. There's not enough, today. So, we're in the space where we need to collaborate more so we can reach more people. So we started with that and started, exploring different angles, data, regulatory, just like, what's your problem? Come tell us. Let's see how to solve it. And then we realized, so many things I used to take for granted in my career. I have a long career working, across sub-Saharan Africa. I like to say, listen, I've sold a healthcare product in every in every English and Portuguese speaking, sub-Saharan African country, with the exception of RSA, South Africa. And then Mauritius as well. And, in all of that, I mean, we did have the cover of Big Pharma and Co. You
Yeah.
know, because then I worked for Big Pharma.
Okay.
We're able to, ideate, execute, sometimes fail, sometimes win, but learn what really makes healthcare work
Yeah.
in Africa.
Yeah.
And when I started consulting without all the security and comfort and support,
Yeah.
I also realized what smaller businesses go through. Today, our healthcare is powered by those smaller businesses. Most of the big farmers left, right?
Yeah. Yeah.
Those that haven't left have scaled back significantly because the economics for them don't make
it's not working,
sense. Exactly. The situation is dire, and we're at the point where we are the ones now having to save ourselves,
Right.
and it's both a blessing and a curse. I say all the time.
Yeah.
So we set out when we started out Infinity Health, we said we're going to do data, primarily because in all my career, we've just never found the right data for market access.
Yeah.
You're launching a product, you need market sizing, you need to understand. You just don't know.
Yeah.
You just don't know too much. There's no centralized data. There's no single source of truth.
Exactly.
And even in big pharma where there's funding to buy data, you find a whole lot of your desk research does not account for much when you come on ground. And so
Especially somewhere like Nigeria.
yeah, but you think it's just Nigeria, but across Africa really.
Oh wow.
And because our data is not harmonized, it's not put in context, the right context, right?
It's not structured.
It's not structured, It's just like when you're looking online, you're saying, oh, the mobile penetration is very high here. Then, but how does that data tell you that, in this place, people turn off their data at night, eh?
Okay, I see where you're coming from.
How does it
now.
account for that?
Yeah,
If you're making all of these plans, based on that, you need a lot more data to drive that context.
True.
You go on a government website and you see, oh, it takes this long to get this, then you go and do it yourself, and 1 year later, you're still stuck.
You're still on it, yeah.
So, these things matter. But what we're trying to solve the data problem, and, I'm one of those people, I believe in first principles, right? So go back to drawing board. Okay. Why is the market not working?
Yeah.
And started to, reconfigure what, I have a whole thesis around this thing. About data generation, aggregation, transmission, whatnot, storage, and all of that. So, yeah. And started to figure out what we'll do, what we won't do. And then we realized you really need a lot of money to do data. And not just money, but, money.
Like money.
Upfront money, without hope of, and then selling knowledge products in itself is also,
it's tricky, yeah.
It's also very tricky, very
tricky.
expensive.
Yeah.
In this part of the world, people pay for services than they pay for advice, right? And even when they pay because services are cheap.
Yeah.
And even when they pay for advice, they're willing to, they will pay premium if advice comes with services. So it's those things.
Yeah.
I'll give you a proper example. So POS, right? Everybody talking about POS and all the drama, right? People who don't have money, mostly poor people, go to POS, spend transaction charges I will never do.
Yeah.
Right? But if you told them that, if there was somebody there who told them, listen, for 100 naira, I will show you how to do it in your own phone. They won't pay the person. But they will pay 100 naira every single time for somebody to use POS to give them cash. Right?
Yeah.
So it's the same principle. It's the same way it's the way that we think and we rationalize it.
Yeah.
So also because, the format, the way we're thinking about building that data, Silicon Valley style, Bloomberg terminal, all of those things. This is not how Africans do things. Yeah. So, while we're still thinking about a model and running out of money really fast, people still used to come to us and say, you've done 16 years in pharma. How far? Who's your NAFDAC guy?
Yeah.
How do I get this license? You know? And so those things I used to take for
Yeah.
granted when I was in big pharma, I started to see that was a real problem for people outside of, much more structured
Yeah.
and supported
Yeah.
environment. And even for people in supported environment, then I didn't do it because it wasn't my job,
Yes. Yes.
All I needed to say was go to our regulatory compliance lady and
I
like, so why is this, and she's explaining, I'm like, so why,
Yeah.
so it wasn't my problem. But I strongly believe I have a principle. I learned it from Mr. Bayo Adediji of
Okay.
Wakana.
Yeah.
It was one of the last master classes I ever went to when I first started, because I was looking for solutions. And he said to me, Irene, what do you want to do? And I said, we want to change, revolutionize the healthcare. Like, what do you really want to do? Is that why you're here? Revolutionize healthcare. I can't help you do that too.
Where do you want to start from?
But then, he helped me see something. And I said, I want to make money. While doing this. I'm like, no, good.
Okay.
See, because when you have that set, it kind of, influences how you think about what you're doing. So I said, there's a very unstructured regulatory system that does not allow us to have the things that we need to have in this country. And people are willing to pay today.
Yeah.
How about we go in there and start to work within that space and understand the problem? So for 1 year, that's what I spent the last year doing.
Wow.
Understanding the regulatory space. Yeah. We've worked in it for years, but, understanding it from a small business point of view and from a large corporation point of view, and seeing how we can bring in much more sanity into, regulatory compliance for healthcare.
Yeah.
Now, because regulatory compliance for healthcare is very specialized.
Right.
It's a very exact science.
Yeah.
And it's not, when people hear regulatory compliance, they're thinking, lawyers, fintech, all of that. And I'm sure those guys, their work is complicated as well. Like, hey, I'm not gonna,
bash anybody.
I didn't even think their work was as complicated, but hey. But, healthcare, regulatory science in healthcare is extremely complicated, especially when you're looking at pharma and co. Like the work that the guys at NAFDAC do.
Yeah.
A whole lot of times when I come online and I see people bashing NAFDAC, I'm like, man, if you ever work there, you will understand,
Yeah.
When we're talking about, I think sometimes online there was a conversation about how many books you read and all that. I'm like, I've read 400 SOPs.
Yeah.
But we've done more than read 400 SOPs. We also learned that people hardly read SOPs because it's hard. True. It's not interesting. Yeah. Sometimes it's not also as clear as they would love it to be, because you see, the person who's writing is writing from a very specific,
like professional
standpoint, point of view, and
complex grammar, industry terms and all.
Yeah, for some of it is that, but think about the people who do, especially, the lower cadre products, food and beverages, and co. Herbal products and co. It's a lot. So, and it doesn't also carry nuance. Yeah. Which is also some of the nuance that, will affect, your approval. Yeah. So we decided to gamify. Okay. So we built what is called a readiness calculator. Okay. Today, in 3 minutes, you can put in your information, answer 10 to 23 questions, depending on the complexity of the product. So 10 questions if it's a food product. All right. 23 if it's medical devices. 17 if it's pharma. Okay. That sort of thing. And we tell you how ready you are for your registration. Oh, wow. It gives you, at a very basic level, everything that you need to get your NAFDAC permit. And the reason is because, once we said, we'll help you get your NAFDAC permit, people came to us with money, but they were not ready. Okay. It's not enough to give somebody money to get your NAFDAC permit. And
fix it. Just fix it. Fix it.
It doesn't work that way. There's a whole quality standard that needs to be adhered to, And so they're not ready. Yeah. And that's when we start to get them ready. So we gamify that so that, you can save time. For us, we set, parameters such that, if you score under 60%, even we can take you as a client.
Oh, wow.
Yeah, you have to book a call with us.
Yeah.
We'll have a conversation. Tell you, okay, this is where you get this is where you get that.
Right.
Which is leading to another product that we're having development where, you have a marketplace of all your compliance providers. Yes, so it's coming in the next couple months.
Wow, you guys see, I like because we've gone through my first 5 questions already, and I'm just so happy with that. So we're even getting into the teeth of it now. Yeah.
So here's the thing. Yeah. One advice I must give you is this: I nerd out a lot about work. I am, I spend too much time, thinking about, this problem, the solutions that, I. We can be here for the next 5 hours. I can tell you all the problems in every different crevice,
But what you guys are actually solving, the problem is a very, very fundamental and important aspect of Nigeria's healthcare.
Yes. So we believe that, and I learned this from working with, one of the best compliance directors we'd ever had when I was in Big Pharma.
Yeah.
So we've always had compliance, and everybody hates compliance. I don't know anybody that likes compliance. Yeah. And they've always been hard, and their job is to say no, ask questions later. Yes. But then this lady, she was really very collaborative.
Okay.
And I believe that's where the future of compliance is. You need to be in a place where people ask the questions before they are caught doing something wrong. So we didn't make too many mistakes because we could come meet her and say, oh, how I'm thinking about this, and if she said no, you can make your case there and then, of course it now means that if you go ahead and do it now, you have, use your church mind to misbehave, but you understand.
Yeah, I get you.
But you see, it made, and compliance improved in the company under her. Because, you see, it became more rational to be compliant than to be non-compliant. And that's where we need to go in Nigeria. Today, it takes close to 2 years to get your products, your pharmaceutical products, in country. 2 years. On the average, I hope they don't beat me up for this, but it does. It really does. To get that drug in country. So, you have somebody who desperately needs it. And, you're working through all of this process. Tell me, is it not easier to put a pack or 2 or 3 or 4 in a bag and walk through the border?
Right. It's much easier. It's much easier that way.
The trade-off of that is that now you have flouted every rule.
Right.
You cannot guarantee quality, safety, storage, because all of these things are chemical compounds, right? Yeah. Nowadays, when people come and meet me and say, I have Ozempic for sale, I'm like,
Where did you get it from? What's the condition of it now?
I was the product manager for insulins and injectables for a really long time. Yeah. So I know how important temperature excursions are, If you carried that thing, you left it in your car, you went out for a bit to greet a friend, came back, it's getting all the, put it back in the fridge. You're just walking around with, what I call a protein broth. Or maybe you said, this fridge is not cooling. Let me put it in the freezer for a few minutes, But every time a product, freezes and defreezes, it loses chemical structure. Yeah. But you see, you can't see anything, right? So it's normal. Yeah. Now me, if that product did not come in through the right process,
be very skeptical.
I should be very skeptical because, one, I've paid premium. 2, I've paid premium for a product that I don't know is safe for use. It's going to work. Yeah. So, and most of the people who use this sort of products for them, it's essential. Yeah. If somebody who is diabetic doesn't get the insulin that they need, even though they're injecting themselves and spending money, they're leading towards death for them. True. Same thing with chemo medication, same thing, all of these things. Even our orals, you're not supposed to take it and, You're not supposed to take it and, just leave it in your car, for instance, and it's but the reason why PCN today, before they give you your license, they do 2 inspections. They'll come first, look at the space,
Yeah.
they'll tell you what to put there, and then they come afterwards as well to make sure that it's there. You cannot have a licensed pharmacy without air conditioning and cold, because most drugs come with, temperature conditions of 30 degrees.
Yeah.